Since I was a child, well, if I can remember, I always wanted to be a doctor. Actually, I wanted to be a bullfighter first, and then I decided that perhaps I didn't have much of a career there, so I decided to be a physician.
I still love being a physician. I like taking care of patients. I like the actual science of it.
I went into it because I was interested in it. I felt it challenging. Just the studies of how the body worked, it was very fascinating. So that's really why I went into it. But now I continue it because I love it.
I like to help people. And I've been doing that now for over 35 years.
JFK Medical Center gave me the opportunity to do that, to help people by having available the finest equipment, excellent staff, responsive administration, and certainly gave me that opportunity to be the helpful person in medicine that I wanted to be.
I would say that the standard of medicine that's practiced here is the best I've ever seen. The JFK Medical Center offers a great opportunity for a physician. There's such enthusiasm amongst the medical staff and the upper echelons of the medical staff and medical exec to try to promote excellence. And I think it shows in our day-to-day operations, and it just improves everybody's attitude.
I entered the emergency room. I ended up being in the hospital for over almost 10 days. And I had some of the best care you could ever imagine. Not only was I well taken care of by the nursing staff and the administration, but also by the doctors and all the people that worked there.
I think we want to be the best we can be. We want to bring new technology and new treatments to the patients. We truly want to see the patients benefit from our expertise. I've been very blessed to have colleagues who I have a great esteem for, and I would trust them to work on my relatives.
And my experience in leadership capacity within the hospital itself is that it's the people that really count, and it's everybody from that individual who carries up the patient's tray all the way to whoever wears the hat of chief of staff or CEO. You could have the best equipment in the world. If you don't have people who can do the job right, it won't stand for it.
It's rated as one of the 100 best hospitals in America, which isn't easy to achieve. It's due to the quality of the professionals, the leadership of the board, and the solid infrastructure that's been there since 1960.
If you look around the community, one of the hospitals that has the top-notch physicians is at JFK.
They clearly have created an environment for care here that is grounded in concern and respect for others. And I'm very, very proud of that.
And the staff is more like a family than just people putting in their day's work.
The thing that stands out to me is the people that we worked with through the years. Just a wonderful group of people. And to me, that was the most important thing.
You can tell when a person cares, not just a rigid pro forma involvement of taking your vital signs, etc. They cared. They really listened to you and asked if there was anything else they could do, and I was very impressed.
They've treated my dad several occasions, and you know, when you're a member of Congress, one of your responsibilities is health care, but when your own father's there and you go and visit him and they've treated him so well, as they have every other patient, not just because he's my dad, it makes you feel good inside that there's somebody there you can count on in those kind of emergencies.
You can have the best equipment, you can have the best location, you have it, but unless you have the best doctors that are here and they're willing to stay and make their commitment at this hospital, you don't have the best hospital, and JFK does that.
As a pathologist, you're very aware that there's a patient attached to the specimen. Making the diagnosis
and making it as early as possible always benefits the patient.
The quality of the professionals, the physicians at JFK is, again, second to none. They're multidisciplined. They're also tremendously involved in the community, not just in the practice of medicine, but in the charitable organizations and such.
Medicine needs to be community focused. It needs to listen to the needs of what the community requires and supply physicians the tools that they need to do the job. At every level, this hospital looks to the community and says, what do you need?
Of all the hospitals, I can unequivocally say, I know politically it's incorrect to say it, I admire this place enormously.
I walk around this hospital and I can't walk 20 steps without seeing somebody I love. What can I tell you? That's why, I mean, I love these people. And they know it, and there it is. It's hard to leave.
The greatest satisfaction for me was taking care of patients and making them well, and getting a thank you from the patient.
I still enjoy my profession, and I love what I do.
Medicine is really the best career in the world, in my opinion. We can be healers. You really feel that you can do a lot for people. To be able to help somebody and get that expression of appreciation, and really when you see the patient is healing and getting better, there's not better feeling in the world.
I think when a patient comes back after you've seen them in the hospital, they come back to the office and they say, well, thank you for everything you've done. I really appreciate it. You saved my life, or you've helped me in some way. I think you never get tired of that.
There's no better profession in the world. There's nothing more noble than being a physician. There's nothing more noble than walking into somebody, looking in their eyes and learning about their whole life, and then opening up to you. To realize that you could do something that even gives them a better moment